My name is Monica Mangensai, and I am a Term 2 nursing student, and this is a simulation for Professor Sink on nasogastric tube insertion and irrigation. So I would perform hand hygiene upon walking into the patient's room, provide for privacy, check the patient's armband. Can you please verify your name and date of birth, please? Okay, the doctor has ordered a nasogastric tube to be inserted for decompression of your stomach. So I am here to install that. I'm going to gather my supplies. I'm going to need several strips of tape, my pen light, the nasogastric tube. The most common tube for decompression is the Salem sump tube. We have a fastening device to affix the tube to the patient's gown, our clean gloves, our lube. We have a drink for the patient, towel, and we have our irrigation syringe and vial over there. So we're going to get started. The first thing we're going to do is we're going to assess the patient's oral cavity and their nares. And can you please occlude your right nair and breathe in, and then the left, and we would decide which nair is more patent or has stronger breath, and that is the nair that we would choose to install the nasogastric tube into. And we're going to apply our clean gloves. Next, I'm going to mark the tubing from the nose to the ear to the xiphoid process, and I'm going to put a piece of tape to mark our tubing. Now we're going to get ready to perform our procedure. So we need our patient sitting all the way up. Remove the pillow and have the patient put their head back. And we are going to lubricate the tube up to 4 inches. I will be installing it into the right nair. So we will proceed the tube. And we're going to assess the patient for any gagging that they may be experiencing. Okay. And we're checking the back of the throat, and we do see the tube present and it's not coiled. So at this point, we should have had a towel to help protect the patient. We're going to ask the patient to put his head forward and take some sips of something to drink, and as the patient swallows, we are going to progress the tube to the point that it is marked. Once the tube has been progressed to the marked point, then we are going to check to make sure that it is placed correctly. I would ask the patient to speak. I'm going to check the back of the patient's throat to make sure that it did not become coiled in the back of the patient's throat. I'm going to make sure that it is inserted to the point that it is marked. I am also, at this point, going to aspirate for stomach contents and check the pH. And then once we have checked the pH, verify that it's within the range for stomach contents, then we are going to return the rest of the aspirant while listening to the epigastric region with our stethoscope.
I'm like nervous.
And we should hear a whooshing sound
I'm so tired.
upon return if it's going into the stomach. Then we are going to connect this to the section, and we are going to
Have you finished any video?
fasten
Oh
our
my God, didn't you just catch
device. Okay. Here. And we are going to document our procedure. We need to have the date, the time, my initials, of course, the size of the tube, the type of tube, the fact that it's hooked to suction, how well the patient tolerated it, the length that the tube was inserted, and any drainage that has come from the tube at this point, with color and consistency or characteristics of the drainage. After that, we are going to prepare to irrigate the tube. So I would return to the patient's room, perform hand hygiene, and apply a new clean pair of gloves. Then I would remove the tube from suction. First thing I'm going to do, because I want to check, sorry, the tube should have been fixated to the patient's gown. So we'll do that real quick. Sorry about that, Mr. Johnson. Okay, to irrigate, we are going to withdraw and check the pH. We're noting that the tube is still inserted to the marked point on it. The pH is consistent with stomach contents. The patient is breathing and talking. We're going to return our aspirants while our stethoscope is on the epigastric region, and we're going to listen for the whooshing sound again to verify that the return has gone into the stomach. Then we are going to draw our irrigation. We have 30 milliliters here of just normal tap water. The stomach is not sterile. We are going to irrigate. And we're going to see how much we can get back. And we would return this to suction, discard this, and we're going to document the type of irrigant used, the amount of return. If we did not get back as much as we put in, then we would document that in the intake portion of the patient's medical chart. Date, time, my initials, how well the patient tolerated it, pH test if that was performed, and the color and characteristics of anything that we received. And that is nasogastric tube insertion and irrigation.